I'm a practitioner in practice, 30 years. I'm in Central Maryland is where I practice. And so I first brought Sumis laser into my practice roughly 15 years ago. And that was for musculoskeletal conditions. And it was just phenomenal. It just really revolutionized my practice then. And I have two of them now. I have had two for a while, and they just run all day long. So anything with pain, inflammation, anything that needs tissue healing, it's just phenomenal technology. So roughly 6 years ago, something like that, I got trained up in how to treat peripheral neuropathy using Sumis laser. And that was the next revolution in my practice. So I came back and started doing that, getting phenomenal results and really seriously helping people who could not get help anywhere else. And you really have an opportunity to change lives with this. It's quite profound. And so let's just get right into it. So this is our webinar on revolutionizing your practice with neuropathy treatment. And first of all, let's chat about briefly, what is peripheral neuropathy? So peripheral neuropathy, of course, is an umbrella term, and it covers a lot of things. Any nerve pathology, really, that involves the peripheral nerves as opposed to the central nervous system would be classified as a peripheral neuropathy. So for example, carpal tunnel syndrome would be a peripheral neuropathy, as would a lumbar radiculopathy. That would also be a peripheral neuropathy. And what we are actually going after, and what this seminar is really about today, is about treating the superficial sensory nerves in the lower extremities that become involved in peripheral neuropathy conditions from a variety of causes. These are small and large diameter nerves that carry sensory input from the environment to the brain. So your ability to feel the floor, feel the brake pedal, determine pain, temperature, cold, hot, et cetera, your peripheral nerves, the superficial sensory nerves in the lower extremities, provide that information. So what happens in certain conditions, those nerves will become either inactive or they, in some cases, can actually die. And so what we find is that we have the ability to go in and really help restore or rejuvenate or wake up, if you will, many times these peripheral sensory nerves when they're not functioning properly. And it's quite dramatic when you're able to do that. What are typical peripheral neuropathy symptoms? So we're going to talk about this in a minute, but I'll just say it now. So diabetic conditions, right? Type 2 diabetes is a biggie. Idiopathic is another category of these folks, which may have something to do with vascular. It has to do with age, and be older folks. They get these symptoms in their feet and toes and in the lower legs, and sometimes up the leg as well. And balance also becomes an issue, right? They become unstable. If you can't feel the floor very well, then it's hard to maintain good balance when you're walking. And I've often used the idea of the concept of one's world kind of closing in on you, because what happens with these folks, it is a progressive disease typically. And so you go from being able to walk to being able to not walk very well. And then you have the cane, and then you have the walker, and then at some point you have the wheelchair, right? Peripheral neuropathy is the #1 cause of non-traumatic amputation. And anybody who's a diabetic is aware of that. And they have that in the back of their mind as a future possibility for them. And once you can't feel the brake pedal confidently, then you have to turn over your car keys. And so there again, your world kind of closes in on you, and you can do less and less. How big is this problem? Well, it's huge, right? There's a huge population of patients that suffer from peripheral neuropathy. And the big story here is that they are not getting help anywhere else, really. There are treatments for them, but there are no real solutions available except for what we're going to talk about today. So what's going on at the actual site? In the epidermis, if you look at the fine nerve fibers, you see the pictures here. We have two, one on the left, one on the right. You have the non-diabetic on the left and the diabetic on the right. Now, there's been some contrast material in these photos, of course, and so the green color and the arrows point to very small sensory nerves right in the epidermis. And if you look at the diabetic patients, the same kind of area, same tissue area. Where are they? They're gone. They went away. So we believe in the research. What the research is suggesting is that the vascular compromise plays a role here. Glycolation from too much sugar in your diabetic folks. Post chemotherapy insult from the chemotherapy products that are used on the superficial sensory nerves. And other drugs, side effects can cause that as well. Other conditions, we'll talk about that in a moment, but you get the idea. So there can be a loss of function and even in some cases, a loss of these sensory nerves. And so therefore you have deficits in your brain's ability to interpret or get information about what's going on in the environment from your lower extremities. And that presents a lot of trouble. So here's the common risk factors. These are common. Now there are others. This is not an all comprehensive list. Diabetes, vascular disease, post-chemotherapy, those are the three biggies you're going to see in your practice typically. Traditional medical treatment, what do they do? What have most diabetic patients or other neuropathy patients, what have they done? Most of the time they'll go to their primary care. Most of the time they'll be given, these days, typically psychotropic or anticonvulsive medications. Cymbalta, Lyrica, gabapentin, those are very common, right? Most patients tell me that those medications don't really work. They may give some symptom relief, but they don't solve the problem. They don't actually affect the nerves. They basically help you to possibly diminish your perception of pain. So you may not feel the pain quite as much, but the problem actually progresses over time. And so it's not really a solution, frankly. Other than opioids, we know there's an opioid crisis, so that's not a good choice in these days. NSAIDs, there's problems with that as well. So we really don't have, in traditional medical care, we really don't have a good solution, particularly long-term, for these patients. Photobiomodulation. Now, this is probably a new term for you, for many in the audience. Laser therapy is photobiomodulation, and class 4 laser. And that's where the research is. If you look at the serious scientific research in laser therapy these days, which is photobiomodulation, it involves class 4 therapy lasers. What do? They do a number of things. Let's walk through them. They reduce pain. There's mechanisms involved that allow them to help reduce pain. They have a very positive physiological effect on tissue, biological tissue. They also enhance tissue healing. Photobiomodulation enhances tissue healing. You actually accelerate the production of ATP. And if you have more ATP, of course, that's your body's energy source, right? You can do more repair and you can do it more quickly. So photobiomodulation also increases circulation. There's a thermal gradient involved, and there's other factors involved as well, nitrous oxide, so which causes vasodilation, right? So the microvasculature actually increases its ability to flow under the photobiomodulation effects of laser therapy. And resolve inflammation. Now, this is a biggie, and let's talk about this for a moment. You'll hear a lot of times various companies and so forth will talk about reducing or stopping inflammation. The natural healing process actually is inflammation. So inflammation is necessary and is an active part of healing tissue, and the tissue really needs to go through it if it's going to properly and fully heal. So what's interesting about photobiomodulation is it actually helps that process go better, quicker, faster, and more fully. And it just enhances and helps to guide the patient kind of through that inflammatory process so that full healing can be restored. And it's quite profound when you see it in clinical practice. It's quite profound. Here's some visuals, right? Better circulation on the left. Now, another thing I didn't mention, but I will now, is that photobiomodulation actually triggers an increased oxygen release from the hemoglobin. So that's another factor that comes into play that's a positive factor. On the right, the slide or the picture on the right, that's a representation of the C-cytochrome oxidase reaction that actually makes ATP. And so under photobiomodulation, that little reaction just goes ching, 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 and just kicks off the ATP faster than it normally would. And that's always a plus if you're trying to heal tissue. There are different structures in the tissues in the body. that are referred to as chromophores, and they absorb different wavelengths of radiation, or the photobiomodulation, I should say. We're dealing with infrared, near infrared light is what it is. It's light energy, basically. What we're doing is delivering joules of energy into the tissue. And so, like on an AM radio dial, if you turn the knob, the little cursor goes over and you'll tune into different radio stations as you move across the dial. So it's similar in that different wavelengths are absorbed by different chromophores: water, hemoglobin, melanin, right, in this schematic here that you're looking at. So what's interesting about the Sumis class 4 laser is it provides all 4 of these wavelengths. And another thing that I like about it is, in my practice, is that the conditions that you would want to treat, let's say you're a frozen shoulder, let's say carpal tunnel, let's say a lumbar disc herniation, whatever, you name the musculoskeletal condition, it is in the software of the Sumis laser. So you just pull it up and you push the button, and the protocol is already programmed into the laser. So it'll deliver the right amount of wavelength at the right time, the right amount of power, et cetera, et cetera. So it's really a no-brainer, easy to use, and phenomenal clinical outcomes. Some people who don't yet have laser in their practice may be looking around and trying to decide, gosh, what do I get? What do I get? The lower powered lasers, class 3 and below, those are just that. They're lower powered lasers. Class 4 gets you into the range of power to be able to deliver enough joules of energy into the tissue that will get the desired effect, or the desired clinical outcome, that is a very positive one, in a shorter period of time. So it's not that the lower powered lasers don't do anything. It's that the length of time of treatment just gets wider and wider, longer, if you are using one of those devices. So the class 4 gets you into a much shorter treatment time. For example, in my office, the typical musculoskeletal body part that we would laser, 3 to 5 minutes in that range is typically a treatment time. So it's quick, and it's effective, and it's very efficient. Another thing I'll say is that you can have too much power. So you don't want a laser that has too much power, and you don't want one that has too little power, right? You want to be like the Goldilocks principle. You want to be in the middle. You want to be in the sweet spot, in the zone. And Sumis has just totally hit the bullseye on finding the sweet spot in terms of power and wavelength and variability and pulsing and all of that. It's quite sophisticated what they've come up with. Well, photobiomodulation for neuropathy, drug-free, right? That's a good thing. Scientifically proven. There's a lot of good science in the literature. It's been shown to be over 90% effective, and I see that in my practice, of course. No surgery. Boy, what's not to love about that? And probably best of all, minimal or no adverse side effects with photobiomodulation, that is laser therapy. What's not to love, right? So if we recap comparing photobiomodulation to the standard care of medications, right? So the photobiomodulation actually treats the condition and the pain, whereas medication only manages pain, and sometimes it does that poorly. Laser therapy has minimal or no side effects, whereas medications can have quite severe side effects. So when you really do the pros and the cons, compare and contrast, it becomes pretty clear what the best choice is. Our treatment protocol for peripheral neuropathy that we teach is standardly a 16-visit protocol. It can be delivered 2 to 3 times a week, so twice a week or 3 times a week. They both will work. You'll get the same outcome. They'll get better faster if you're doing it 3 times a week, and that just makes sense. Frequency does matter. It's about a 30-minute treatment time for a peripheral neuropathy treatment, even with a class 4, because you're lasering both legs, both lower extremities, and you're actually delivering some photobiomodulation to the cauda equina region in the lower, and in the upper, I should say, the thoracolumbar region, and in the upper lumbar spine. So you are delivering a little bit there. That's part of the protocol as well. Now, in my office, we have 2 Sumis lasers. So I have a staff member, a CA, actually will take a laser. Each will take a laser, and each will take a leg. So they do the same time. And so we actually deliver the neuropathy protocol in half the time, about 15 minutes, we get it done. Let's look at a couple of case studies. This is John. John is 86 years old. He's currently under care in my office for peripheral neuropathy. I just circled his initial complaints, right? Continuous burning, discomfort, bottom of the left and the right foot, and into the lower legs as well. And now, when you work these folks up, you're going to obviously do a good history, good exam, good differential diagnosis. You want to make sure you have the correct diagnosis. And so one thing we picked up, screening his lumbar spine, we picked up a weakness in the left hallux extensor muscle, which is L5 innervated. So we know he has an L5 radiculopathy. And he's in the process of getting, I think he's scheduled for a lumbar MRI as we speak. So we'll be investigating his lower back. And no doubt we'll be treating his lower back condition, whatever that turns out to be. The assessment here, you see peripheral neuropathy, lower back pain, lumbar radiculopathy, weakness in left lower extremity. All right. Now, we do outcome data on all of our patients, and we expect to see great outcomes, and we do see great outcomes. So on John's initial low back disability questionnaire, right? This is a revised Oswestry. Look in the initial, the one on the right would be the mid-eval. Now we do a 16-visit protocol. So somewhere around visit number 8, we do a reevaluation. We go in and we check pinprick and vibration loss. We check symptoms. We just take assessment of where we are halfway through the protocol. Now, obviously, we pay attention along the way, but we do an official reevaluation halfway through and document all of that. So what's interesting here with John, so this is his lower back. Now, we're not treating his lower back officially. Now, he does get some Sumus laser to the low back as part of the neuropathy protocol for his lower extremities. But even so, he started out with a 64% disability, and that has now dropped to 56%, so that he's moving in the right direction with his lower back, even though we haven't yet started really treating the lower back. I thought that was quite interesting. And if you look at the lower extremity functional scale, when he first started out, he was an 8 on the left, and that has more than doubled to a 19 if you look on the right. Now, the lower extremity functional scale, the bigger the number, the better they're doing. On the other one we were looking at, it's just the opposite of that. So in both cases, John is making progress and moving in the right direction. Now, if we look at pinprick and vibration loss, when he first came in on the left, you can see he had complete loss of pinprick sensation in the plantar aspect of both feet. So you could jab him in the bottom of the foot. He didn't feel a darn thing. He just laid there. Spotty vibration loss. So throughout his lower shin into the ankle and foot region, he had some patchy loss of vibration sense. He could feel it. He could not feel it. He could feel it like that. This is the tuning fork, of course. Now in the mid-eval, his pinprick has completely returned. So now you poke him in the bottom of the foot and he withdraws his foot because it hurts. He feels it. And that's just amazing when you see this happen. Vibration sense is returning as well. He has just a little bit yet around the ankles, but in the shin areas, vibration sense has returned as well. I cannot tell you how amazing it is. I've been doing this a while. I've been seeing a lot of folks, a lot of neuropathy patients, but I still, it just blows my mind to see these people where I can jab them, they can't feel it, and then just very shortly I poke them and they say, "Youch," and they pull their foot back. And it's just, of course, I hear other things. I can feel cold. I can feel hot. I love it. Oh my God. I can feel my shoe. I can feel my toes rubbing together. It's quite amazing. You just literally can change these people's lives. Let's go on to Candace. So Candace here, you see she has her initial evaluation. She has, again, a stocking distribution. You see here, she's lost pinprick and vibration in her feet. Plantar aspect as well. And then on the mid-eval with Candace, you can see where there is return of her pinprick. Her pinprick is actually returning. You can see on the bottom of her feet there, the plantar aspects, there's areas where the pinprick is returning. And of course, in the legs as well, she can feel pinprick coming back and vibration coming back as well. She also mentions to me, I like to write quotes down when they say this, she said, "I'm feeling hot and cold now." So that's pretty cool. Now, on her end eval, she finished the 16-visit protocol, and you'll see on the end eval, pinprick and vibration have completely returned. So it's beautiful. And she's out of pain. Symptoms have gone away. She's 100% improvement. And I actually followed her a month later. I released her from care, and then we followed up in a month just to check. And she was still doing great. Pinprick vibration completely intact, and symptoms completely gone. She was loving life. So it's continuing to just be better and better. So she's very pleased with that. And let's see if we can listen to Candace here. Tell us about that.
I have been diagnosed with peripheral neuropathy in my feet for probably 4 or 5 years now. I've done different treatments, nothing had worked. It has just gotten steadily worse to the point where I feel like I'm standing in a campfire 24/7. I know from the first treatment, I stopped getting the shooting electrical pains that would go up my legs. Slowly, it's like different parts of my feet are waking up again.
Candy, you've completed your 16-visit neuropathy protocol. How did it go?
It went great. They're feeling better every day. I've noticed so much of a change. I can sleep through the night now.
So there's no regression?
No.
Okay. Beautiful. That's what we like to see.
I'm 100% better than when I walked in the door.
Thank you for that. And let me just say that this is a typical outcome. All right, let's look at Marc. Marc came to me in end-stage renal failure, and he had a really bad case of peripheral neuropathy. Again, you see the stocking distribution, loss of pinprick and vibration. He was hospitalized for an infection, and during his hospital stay, they gave him an IV of prednisone, and it was the prednisone that actually caused the peripheral neuropathy. After that, his feet were just on fire. And so he came to me, he saw my ad, came to me, and just hoping and praying that I could help him. So he was a good candidate for the protocol. So we put him on the protocol, and there's his initial and there's his mid. So by the time he got to his mid eval, I think it was visit 7, I believe, his pinprick and vibration have all returned, and his symptoms had pretty much resolved. It was just very, very dramatic. It was quite impressive. And Marc's a good guy. Now, Marc, interestingly, did not get a chance to totally finish the protocol. He got to visit 14. It's a 16-visit protocol, so he got to visit 14, and he got the phone call for that kidney transplant. He went out and had that, so we did not see him back, but he was just as pleased as can be with his care. Let's listen to Marc here. So, Marc, what brings you to our office today?
I have severe issues with neuropathy, and I have numbness, tingling in my feet, as well as like loss of feeling. After my first treatment, I noticed less tingling in my feet, and it started giving that soft feeling back like normal. It's going great. After the second treatment, tingling's almost gone. I have more feeling in my feet. I'm actually taking full steps and walking now.
So, Marc, you're halfway through your neuropathy protocol. How is it going?
It's going well. I'm able to walk again. The tingling and the numbness and the pain's gone. I have no pain at all in my feet. Pain or any of that tingling that I came in here with, it's all gone.
Oh, that's fantastic.
Nothing.
That's fantastic. So again, results are typical. What we find with our patients is that, our neuropathy patients, is that vast majority of them will get 80 to 100% better, symptom-free, and again, their objective findings return, pinprick and vibration, et cetera, heat, temperature, all that. You'll have a smaller group that will get 50 to 80% improvement. Let me tell you, that's profound for a neuropathy patient who's up all night, they can't sleep, their feet are on fire, et cetera, et cetera. Even 50% better, they are very pleased. There's a very, very small group that will get 30 to 50% better. So that's how it all breaks out. Majority get 80 to 100% better is what we see in our practice. But again, when you're dealing with neuropathy, nobody else can really help them. And if you can even give them 30, 40, 50% improvement, they are just absolutely so appreciative. I just can't tell you, they're very pleased. Let's just talk for a moment about financials, right? So no, we're all docs, we're all here to help people. This is why we're in practice. We're here to make things go right for folks. However, we have payroll, we have overhead, we have to keep the lights on, we have to pay the bills, right? Got to pay the rent and all that. It is a business. Running a practice is a business, and you can't forget that. So just for a moment, let's put on our business hat and talk about that. A Sumis laser in your practice is an income producing asset. So my 2 Sumis lasers run all day long, and they generate private pay income all day long. So that's just how it rolls. And this is true for other docs. Now, I'm the main trainer at NTC Training, and I train docs across the country on how to treat neuropathy with laser, and they go back, and this is what we see. They just start increasing their private pay income, which is quite nice. If anyone's interested in that, that's something that's, we're all, I mean, that we've all been in the clutches of the insurance companies, and they control us, and they don't want to pay you, and reimbursements keep going down. And I don't have to tell any of you that, because you're living it like I am. I tell you what, you can break the clutches and get out of that to a degree, and quite a large degree if you'd like, if you can increase a service that would be a private pay service such as this. And with the Sumis laser, I'm going to tell you, patients love it and they want more of it. So this is something to just to think about. And I will tell you, I'll share with you that of our docs who come and do the NTC training, that is, they get a Sumis laser with the NTC software, or if they upgrade. Now, if you already have a Sumis laser, you can simply upgrade to NTC. Come to the training, we train you up completely, soup to nuts. We train you, we train your staff, we train your associates. So Monday morning, you're ready to deliver. So we find that those docs, they go back and typically will generate $10,000 to $20,000 a month in extra income just from the laser. And some docs are doing significantly more than that. It's wide open. Depends on how many people you want to help, really is what it boils down to. All right. So supercharging your practice. I would like to invite Betsy to come back and talk about this. Miss Betsy, are you there?
I am here. So some of you in the audience might be wondering how you even get started with a laser, and how do you know how to use it and treat it, and how do you reach the patients that are going to be coming to you for a laser. And I just wanted to share a little bit with you about what we do as a company. Again, this is really about neuropathy and treating neuropathy, but we just want to take a step back and educate you a little bit about using laser therapy in your practice. As Dr. Lewis mentioned, all of our lasers come pre-programmed with protocols that you use. But when your local rep, our reps, install it in your office, they'll go through a full training with you on how to use it. And then we also have ongoing training where you can talk to our medical director. I mentioned Dr. Phil Harrington before. And then we also have some other doctors who work with us you can reach out to. So we have clinical advice and experience available on a regular basis for you. And we also do things like webinars and continuing education. So we're constantly looking at doing as much training as we can. You want to hit the next button for me, Greg?
Well,
that's training and ongoing. Okay. The other thing we do is we really make sure that you reach your potential patients by making sure that you have marketing available to you. We do this by having it all online, and it's customizable so that you're able to put your information, your logo on it. And then the other thing that is so great about what we do in supporting our providers is that we have domestic service right here in Franklin, Tennessee, right outside of Nashville. We have rapid turnaround. And if for some reason we're not able to do it right away, which the majority of the cases we do have a loaner program. So it's so important to know that when you have an asset like a laser that you're using all the time, your patients love, supporting earning money for your practice, you don't want to be out of it for a long time. We know the value of it, and we really focus on making sure we support you from all angles. That's just a little bit about how we support you if you have a laser. And then rolling into that, if you purchasing a laser, you can also purchase the neuropathy protocols. Or if you already have a laser with us, you can add those neuropathy protocols. And we do an additional training on top of that. So I'm going to let Greg start that one.
Sure. Let me just say that I had a staff member a few years ago that rolled the chair ball, the roller ball, over the fiber optic cable on one of my lasers, and oops. And I'm going to tell you, we called Sumis, and bam, they just were on it. We had one just immediately, just right away. They overnighted the thing to us. So
I will say, Sumis Medical Laser was started by a former chiropractor, and there's quite a few chiropractors in our office, and they all used lasers in their practice, and they knew the value of them, and they knew the value of keeping them working. So service is something that we value here. So
it's phenomenal. Yeah, it's phenomenal. Okay, let's talk about Neuropathy Treatment Center. So the idea here, what is that? So the idea is you can take a sub-practice and plug it right into your existing practice. And that is to treat neuropathy patients. You can market and you can attract and you can treat peripheral neuropathy patients. There is a huge population of patients who are desperate for help and they're currently not being served. They're not being served well. And this is not to be negative at all on the medical care. It's just medicine just doesn't have a good answer for peripheral neuropathy. It's just the truth. And with your Sumus laser, you can come in and literally change their life and turn it around, maybe keep them from that amputation down the road. Just how profound is that really when you think about it? So the Neuropathy Treatment Center training that we do, now I'm the main trainer, but Dr. Phil also, we co-train, right? We're there on the weekend. It's a weekend training. You fly to Nashville, you come to Franklin, which is just outside of Nashville, and it's a Saturday, Sunday. So Saturday is all about the clinical, the science. We handle more in-depth in the laser physics and what's really going on. And then we handle how to do a good history, a good exam, right? How to do a good differential diagnosis, run through all the possibilities differentially so that you make sure that when you're done with your exam, you really have the correct diagnosis. Then we show you how to do a good exam, neuropathy exam. And then we also give you hands-on training. So you'll have your hands on the actual laser wand and you'll get the proper speed of delivery. You'll learn how to operate the laser itself. You'll literally know everything you need to know to go back Monday morning. And it's like turnkey. You're ready to roll right out of the gate Monday morning. You are ready to deliver care and get great outcomes from neuropathy patients.
I was just going to say.
That's in the Neuropathy Treatment Center, right?
Let's put up the whole list.
I'm going to walk through them. So we have the neuropathy protocols, and those are programmed into the machine. And then we also have the proven business plan. So we walk you through like how to set this up, how to run it. You don't have to overhaul your office. You don't have to do build out. You don't have to hire new staff. This can be plugged right into your practice and very easily and very, very nicely. Now, Dr. Phil Harrington and I, we are the two experts that train at the NTC training on Saturday and Sunday. And Dr. Phil is the science guy, right? Dr. Phil is full-time with the smartest guy in the world on laser therapy, photobiomodulation, the research. He even knows a lot of the researchers around the world. This guy is plugged in. So he really is a tremendous asset. And I'm the clinical guy, right? So I'm actually in the trenches like you. I'm actually treating patients. And I have a lot of experience firsthand actually doing this. And so I'm there to provide that clinical picture, what's going on, troubleshooting. You run into this, what about this, what about that? I get texts a lot or phone calls. Hey, doc, I got this patient. This is kind of a curveball. What do you think? So I help them. I walk them through that, what to do and what to think about. So marketing materials, we have that. Betsy mentioned that already. So I share with you what I've actually used in my practice. I've done some billboards. I've done some ads. I've done some direct mail pieces that have been very, very successful. I share that with you on Sunday morning. And then Sunday morning is also case acceptance for private pay. So I train you on that, and I will train you ethically, honestly, how to better communicate with your patients in such a way that you're going to find that case acceptance is going to be very easy. They just can't wait to get started. I also train you on doing a workshop. Before COVID, I did a once a month neuropathy workshop, and we would have a full house for that. And we would sign up everybody there always wants to do it and wants to get neuropathy treatment. So in fact, I would frequently get interrupted while I'm in the middle of my workshop. I walk you through it or walk them through it. Some hand will shoot up and they'll say, you know what, doc, I've heard enough. I'm ready to start. Where do I sign up? When can we just get started? And then of course, everybody else just piles in. And so we end up typically having 100% sign-up rate for the workshop. I will show you how to do that. I'll share with you exactly how I do it and what I say, et cetera, et cetera. So this is all turnkey. It's all designed to help you be more successful, because what's the mission here? The mission is to help more patients, right? You have a huge population of patients that really need our help, and we don't have enough docs out there helping them. I mean, it's explosive. The peripheral neuropathy population is just getting bigger all the time. Think about diabetes, how that's growing, et cetera, et cetera. So there's no shortage of patients. And if you're a chiropractor, I'll just say this: if you add neuropathy treatment center to your practice, now you are going to tap in to a whole population of patients who currently are not coming to you. Now, neuropathy patients, I don't care who they are, I don't care where they're coming from, if they think you have a solution for their problem, they are in your office. So it's amazing. It's just amazing. So it's tapping into a whole nother population.
Greg, I want to point out that as really that's true of any modality doctor that's going to offer this. And the interesting thing is, as a family practitioner or family physician, you may already know all of these patients who have neuropathy, and now you have an in-office solution to offer to them. I just wanted to broaden that statement, because people who have neuropathy, they are looking for a solution and they need.
That's a good point, and thank you for bringing that up. So chiropractors aren't typically treating peripheral neuropathy patients. Now they have them in their office, they're there for back pain and neck pain and other things. But if you actually have a solution for peripheral neuropathy, that just opens the door to a whole population of patients that aren't currently coming to you. If you're a primary care physician, my gosh, you already have peripheral neuropathy patients in your practice and they're all on Lyrica. Those folks, you can expand what you're doing for them. You can really help them. The medication's fine, but I'm going to tell you, when you actually put them on a neuropathy protocol using your Sumus laser, it's just amazing how things change. The pinprick, the vibration comes back, their feeling comes back, the pain and temperature comes back, right? Their symptoms go away. They can sleep at night. I just cannot tell you how appreciative they are when you're able to do that for them.
You're not enthusiastic about this, are you?
No, not at all. Not at all. Yeah, maybe I'm hyper caffeinated. I don't know, maybe, right? No, I tell you, I've been doing this for quite a while. I've seen, I don't know, hundreds of neuropathy patients, and I still marvel at the results. It's just so cool to sit there and just watch this unfold. Now, Neuropathy Treatment Center, I mentioned that Saturday, Sunday, right? In Franklin, Tennessee, which is near Nashville. So we always get feedback from our attendees, and we have we have physical therapists, we have primary care physicians, we have pain management people, we have podiatrists, we have chiropractors, we have everybody. Everybody's welcome. And we have a wide range of folks. And so we always get feedback as to how did it went, how could we do this better, et cetera, et cetera. So here's an example from Dr. Marc in Florida of his impression of what he got from neuropathy or NTC training. Here we have Dr. Jordy from Wisconsin. This is her viewpoint on what she got from it. And this is Dr. Laura. And you can see now, we share these with you, these three examples. These are really typical responses from the NTC program. We just could go in randomly and just pull these things, and this is what you're going to see the feedback to be across the board. And I'm telling you, they go back Monday morning and they deliver, and my phone blows up with texts. Hey, my God, we did this, we did that. I saw this patient, I helped this patient, blah, blah, blah. I also hear about, my gosh, our last month income, we had highest ever income, private pay income's up. Oh my God, it's amazing, can't believe it. So I hear all of that after coming to NTC training. So it's very cool. It's easy, Betsy, to be enthusiastic. Can I just say that? You're helping patients, you're changing their lives. You have fair exchange, you're getting paid for doing it. That's got to be a win for everybody. So that's how it should be. The next slide, how about a test drive? Betsy, would you like to take this away?
Sure. So I think the best way to really understand the impact that you can make if you don't already have a laser is to have a demonstration in your office with your patients. And the most important thing is our reps will come out and see you and show you the laser. But when you see it in action with your patients and your patients ask you to buy it, it becomes a whole different reality. It's really a wonderful opportunity to get to see it in use. So if you happen to be interested, just type interested in the Q&A stream, and we'll have a local rep reach out to you. And something that Greg wanted to tell you is If you hit the next
Sure.
statement.
Yep. That's very true. Just watch the magic unfold. That's what I say. Your practice will just never be the same. Your patients will love this. My patients, I'm telling you, I've got patients every day I hear this. Oh my God, that laser is incredible. I love how it feels. They actually feel it. You can feel it. It has a very nice warm, kind of a warm feeling, but oh my gosh, it's, wow, I want to lay here for an hour. Can you do that on me for an hour? Patients want more of it, I'm telling you. And so that's what you're going to find. If you have a demo, and I recommend you do this, if you have any interest in laser whatsoever, have them bring that Horizon to your office and let them demo it with your patients. And you watch the magic. And I'm telling you, your patients are going to love it. They absolutely will love it.